I'd like to welcome Ashleigh Foys to the podcast. She's an endorsed midwife. She's also a nurse. She is an accredited NDC practitioner, and she's going to talk about the changes that occur in breasts after a pregnancy loss. So thank you so much for coming and talking to us about this.
No, thank you so much for having me, Peter. This is such an important topic, so I'm very happy to be here.
So there's so many things. Some women don't have any changes in their breasts, and that's normal. But some women do have changes in their breasts around this time, and that's normal as well. So we just wanted to talk about what changes may have occurred so that women aren't shocked. Because when you get pregnant, one of the first signs is that your breasts get tender and they get a bit bigger. And if you do have a pregnancy loss, that doesn't always just go away the day that you have your pregnancy loss.
No, that's right. And even if I take it back to thinking of myself with being pregnant, that was always a good indicator to me that I was potentially pregnant, was that I experienced some sensitivity in my breasts and they were just starting to feel a little bit what was not normal for me as well. But you're right in saying that. And it's also very important to acknowledge that not all women will experience breast changes in pregnancy, or it might not happen in the early period either. But what's happening is we're seeing that we've got the hormones, we've got estrogen and we've got progesterone as well working behind the scenes there, and they're getting our breasts ready for when we do have our baby so that we can breastfeed. And often what happens is our body has these changes and then we can experience a pregnancy loss, and our body just takes a little bit of time to realize that that pregnancy hasn't continued. So we can still be experiencing those symptoms for a bit of a period of time, which can definitely be upsetting, particularly once you've lost your baby and then you're still feeling pregnant inside, which can be really heartbreaking.
So some of the symptoms that you may feel, but you may not, are that your breasts still feel really full and swollen and sore. You may notice that your nipples look a bit darker and you have raised bumps. Some women notice that fluid does come out of your nipples, especially if you did miscarry further along. And you might see lots of blue veins and your breasts may feel warm. So some of those can be quite distressing. Have you got any tips on how to deal with those?
Yeah, absolutely. So what's happening here is estrogen is working really hard to grow those milk ducts. And so that's why we see that the breast tissue will still start to, increase and grow a bit bigger. And I can definitely understand that when we have that pregnancy loss, that having that there can be quite disheartening. If we're under that 12-week period and we're still in that first trimester, often those hormones can drop quite quickly. But if we are actually past that 12-week mark and a little later into that pregnancy, those symptoms can definitely hang around for a much longer period of time. There's certainly things that we can do to try and make ourselves more comfortable, and things that I would normally recommend for my mothers would be a supportive bra. In terms of that though, we definitely want to stay away from underwire bras. So we're thinking about comfortability, and we certainly don't want any wires poking into our breasts as well. We can do some gentle massage of the breast, but very gentle, and we're not going to be stimulating our nipples at all, because if we do start stimulating the nipples, perhaps our body will start releasing those hormones again and think that we are trying to encourage a milk supply there where we're actually not. We can try some elevation as well, thinking about having our body sitting upright so that our breasts aren't hanging, and using that force of gravity there as well. It's really important that we look after ourselves, so we want to try and eat as much as we can tolerate, but more importantly is keeping up our hydration and our fluids. And we certainly want to avoid anything that's restrictive in terms of tight clothing, and back to those bras as well. I guess the fear is here that we don't want to cause any perhaps blockages, which could then in turn lead to an infection, perhaps mastitis as well. If we do have those symptoms still hanging along for a period of time, and I guess it's becoming more uncomfortable or more concerning to us, we can actually seek medical advice, whether that be see our GP or a private midwife or somebody that's in your space providing healthcare to you. And we can actually look at a medication for helping to suppress the milk that may be there as well. And this is probably more relative to that later stage in those pregnancy as well. But I guess it's also really important that we are aware that if we continuously experience pain and it's quite persistent, or perhaps our breasts do develop some warm or red or even more tender spots than what we had been feeling. And certainly if we're experiencing any flu-like symptoms or any fevers, it's really important to seek medical advice there, because perhaps we have developed a bit of an infection and we might need some antibiotics to treat that.
Yeah, I think one of the biggest myths around mastitis is that you can only get it after you've given birth, where we know that you can get it during pregnancy as well.
Well, absolutely. And you're so right there, Peter, because we actually know that men can get mastitis and we also know our infants can get mastitis. So you most certainly can get mastitis throughout that pregnancy. And it's really important that it is handled correctly, because it's quite an uncomfortable feeling, but it's also really painful. And there's nothing worse than feeling sick. So being sick and pregnant is not something that any woman really wants to experience. So it is very important that we do know what the signs and symptoms are of that, and that if it is continuing past that 24-hour period and we're still feeling quite unwell, that we do seek medical help so that we can get some antibiotics to get on top of that.
Yeah, and are there any other tips that you would give women during this period about their breast health?
Yeah, absolutely. I think it's really important that you know how to handle your breast and know what's normal for you. So I would definitely be encouraging exploring what your breasts feel like, so that when you do have some lumps or bumps, that you know that that's not normal for you, and so that you can escalate that and, speak to your GP or women's health nurse for a referral about that.
Thank you so much for this.
No problem at all. It's such an important topic, and I guess it's a bit of a taboo subject, isn't it? Because when we do experience a miscarriage, often we'll talk about the bleeding and having the pain and discomfort in our abdomen, but we forget to mention the breast changes. And I think if we think about when we're talking about early pregnancy symptoms, we often say breast changes is one of the first things to happen, early in your pregnancy. So of course these symptoms can be there if we have experienced a miscarriage. And I guess women should be aware that these symptoms may, last a week or two, even after that pregnancy has no longer continued.
Yeah, and we just want to really reassure women that even if they do not have changes in their breast, that's normal as well.
Absolutely, completely normal. And I always try to reintegrate that to my mothers, particularly when, even they're later in pregnancy. Some women can become quite concerned that they don't experience any leakage of colostrum. And again, it's coming back to those hormones and understanding that we've got pregnancy hormones and we've got breastfeeding hormones. So it's very normal under those pregnancy hormones to not experience much in terms of your breast growth or any milk leakage as well, because your body is really smart. And once if you do go on to have a baby and that placenta's removed, that's when the breastfeeding hormones take effect there. So it is very normal to not experience any change in terms of your growth or nipple sensitivity. I think that every woman is very unique, and what changes one woman might experience could be very different to what the next woman may experience.
Thank you so much, Ashleigh, and we really appreciate all the time you've given to this.
Yeah, no problem at all. I really appreciate all the work that you're doing for this important cause.